THH Vancouver posted on Reddit. THH. I know what Vancouver is, but what is THH? Is that some internet abbreviation again that I don't know? WTF. FYI. LOL. TBH Vancouver wants to know if he should switch from the public health insurance to the private health insurance. He says the offer is too good to be true. Let's see if it really is in this episode of Financecouch. It's good to know that your gross salary is about 75,000 euros a year because you need at least 66,600 euro in 2023 in order to choose freely if you want to be a member of the public health insurance or the private health insurance, or you're self-employed. Employees earning less than 66,600 euro are forced automatically in the public health insurance, and there's no way to escape, because you have to pay into Social Security as an employee, health insurance, public pension and whatnot. Only self-employed can exit under certain conditions. Now, in order to determine if private health insurance will be a good deal for you or not, in terms of price to coverage ratio, we first need to know more about your current public health insurance. What we do know for sure is that you have a 1-star coverage. If we think of coverage in terms of hotels from 1-star to 5-star, all public health insurances are 1-star coverage. Some public health insurances pay a little more than others here and there, okay. Then they are 1.1 star or 1.2 star, but at the end they all cover only the legal minimum the government is demanding in our social code. First factor, coverage, check. Second factor, price. We don't know the exact price for sure, but we can come pretty close. The maximum salary in Germany that is subject to public health insurance is 59,850 euro in 2023, and you are way above that with your 75k. On that 59,850 euro, you pay 14.6% for health insurance, about 1.6% in additional contribution, that is the number we don't know for sure, and 3.4% for public care insurance. Don't forget care insurance, guys. That is always part of health insurance and you have to pay for that too. 14.6 plus 1.6 plus 3.4 is 19.6% of your salary you pay currently. Only on the 60k, of course. So 11,730 euros a year or 977 euros a month for your public 1-star insurance. Half of that is paid by your employer, but that's the same for public and private health insurance anyway. So that's what we're working with in terms of price to coverage ratio. A 1-star coverage for 977 euros in the public health insurance. If you want to improve your current health insurance situation, you could increase the coverage or decrease the price. Let's try to do both to make the deal extra sweet for Mr. Vancouver. Because you probably don't want to go into a 1-star private health insurance. We compared certain growth rates of private health insurances in a video just a couple of weeks ago. And trust me on that one. If you want to stay in Germany over the mid or long term, go for at least a 3-star private health insurance. Otherwise, your premium will go up a lot over the years if you choose a cheap quality insurance in the first place. We don't know how old you are, Vancouver man. But if you are 30 years old, a 4-star private health insurance would cost you around 300 euros a month. 50-50 with your employer, of course, including care insurance. And before anybody thinks I manipulated out of the system to get these numbers, I did not. We have 198 different options for private health insurance plans, and none is more expensive than the public health insurance. Even the most expensive 5-star private health insurance plan is 918 euros only compared to 977 euro in the 1-star public health insurance. If you are 40 years right now, your 198 options range from 380 euros a month to a little more than 1,000 a month. So 1 or 2 insurances more expensive than public health insurance. But they're 5-star. And if you are 50 years old right now, by that age you should have made your decision a long time ago anyway, your options range from 500 euro for a 4-star insurance to about 1,250 euros. But again, with 50 years, it's a little late to switch anyway. Those are your options. 977 euros for a 1-star coverage in public versus whichever amount comes closest to the age you're currently in from the screenshots in a 4-star or 5-star private health insurance. And no, private health insurance will not increase when you get older. The entry age matters. I'm in the private health insurance myself for more than 5 years and my plan hasn't increased once. I switched from public health insurance because private is much better for me. And if you think private is better for you as well, let us compare your personal price to coverage ratio with your age and your star level by booking a free meeting with us right here. And now, let's go to the most interesting comments below THH Vancouver's post to end the video. The most upvoted comment from Palasvapiti is what you can read on the internet all the time from people that don't seem to know much about health insurance.
Price will increase with age.
It does not. But let's do Del Kaek do the talking. He answers to host organism that knows someone who is in her 50s and pays 700 euros a month, that he is paying more than 900 euros a month in public. And so is Vancouver boy. We calculated that earlier. So Del Kaek is saying rightfully so that that's not too bad. 1_rich8170 comes from the coverage perspective. Comparing the service you get as a privately insured person versus the months of waiting time you have in the public health insurance. I like that too, to compare the coverage and not just the price all the time. Because the question is, what are you actually getting for your money? Unlikely host 9690 mentioned that you can pay voluntarily more in private in order to decrease your health insurance costs in retirement. That's pretty smart as well. So instead of paying 500 euro for private, for example, you can pay 200 euro more that are saved for your retirement. You pay only 100 of that because health insurance is always split 50-50, but in retirement you enjoy the full benefits of the 200 euro extra savings. And unlikely host 9690 again with another smart comment, man, you should earn a price actually. If you're a high earner, go to private until you're in your 50s and then go back to public health insurance. Not quite sure if you really want to go back to public after enjoying the benefits of the private health insurance for decades, but if you're really worried about rising premiums in retirement, that's actually pretty smart. If you would like to be as smart as unlikely host 9690 and would like to know which private health insurance plan is the best for your individual situation, then let's find out together by booking a free meeting on our website. Take care and good health everyone.